Is our form of health insurance really the most effective? Ellyn Hilliard questions the model which we base our current and future healthcare system on. Is there a less complicated and effective way to stay healthy? Ms. Ellyn Hilliard, Universal Sick Care. Universal Sick Care, Ms. Ellyn Hilliard.
Thank you, sir. Mr. Toastmaster, fellow Toastmasters, my name is Ellyn Hilliard. You know me from political backgrounds, but in another life, I am a holistic nutritionist. A holistic nutritionist is a different model than your regular medical dietitian type nutritionist. A holistic nutritionist looks at health from the entire perspective of the body. We look at the circulatory system, we look at the eliminative system, we look at the digestive system, we look at the immune system, and what might be blocking the body so that you can heal. Traditional medicine has been working off of a model of finding symptoms and trying to reduce those symptoms, primarily through surgeries and pharmaceutical medicine. So I ask you the question, has it occurred to you that the model which we base our current health insurance coverage on might be starting at an erroneous premise? Could it possibly be that the pharmaceutical model may not be the best treatment for degenerative illness, which, by the way, is the type of illness in which we spend the most on our healthcare coverage? Degenerative illness being diseases that occur over time because of lifestyle choices, rather than a car accident or a sudden stroke. Something that is building up in the body because of our lifestyle choices. When I started working with patients in healthcare, I read a really interesting book by Dr. Joseph Mercola. It was entitled, Doctors, the Third Leading Cause of Death. The book was written in 2000, and his premise was that over 300,000 cases a year in America could be documented where it was physician or hospital-related death. That's a plethora of doctor-caused illness and death. It was broken down like this: 12,000 a year unnecessary surgeries, 7,000 a year medical error, 20,000 other hospital errors, 106,000 negative medications, and 80,000 a year infections picked up in hospitals. Mike Adams, who writes for Natural News, a fantastic blogger, wrote that that's 9,000 times more deadly than accidental gun deaths. Maybe we should make physicians illegal. Well, of course not. That's not the answer. However, as a holistic nutritionist, it started making me question whether or not drug therapy could be the most effective. I noticed that there was a discrepancy when we looked at the effectiveness of pharmaceutical medicine. Doctors and studies done in hospitals and clinics are based on something called relative risk, not absolute risk. Absolute risk would be what is stated within the context or the probability of something occurring. For instance, a coin toss. You could say that me getting heads would be a 50% probability. Sure enough. 50% of the time I flip that coin, I'll get heads. So if we were really being honest with someone, we could tell them, if you take this medication and you have cancer, 50% of the people who take this medication will live 5 years or longer. But that's not how pharmaceutical medicine does it. They use something called relative risk. That's a comparison between different risk levels, and it tells you nothing about actual risk. Relative risk takes an incidence. For instance, if you do nothing with your cancer, Russ, you have a 3% chance of surviving 5 years. But if you take this medication, you'll have a 50% better chance of survival. But what they don't tell you is relative risk means that's only, nice, that's only 6%. They don't tell you that the other 94% of the time, you'll die. This is a U.S. National Cancer Institute surveillance study on epidemiology according to cancers and their benefit from chemotherapy. You'll notice that if you actually look at the risk associated with 5-year survival with certain cancers and the use of chemotherapy, there are some cancers, for instance, pancreatic cancer, that has zero absolute survivability. So are we really basing our model on the best form of medicine? A typical cancer therapy, methotrexate, has the following symptoms as a result of taking it: liver irritation, loss of kidney function, reduced blood platelet count, nausea, vomiting, diarrhea, stomach upset, irritation, itchiness, rash, hair loss. The list goes on and on and on. But if you knew that you only had a 6% possibility of surviving 5 years, or you had a 96% chance of not surviving 5 years, and you were going to get those symptoms, would you take that medication? I venture not. So, this might be a better therapy for you. And as a nutritionist, I found out rather than the complicated Obamacare medical model that's going to hold you up several years for getting that therapy in the first place, if it's not effective, maybe you want the simpler model. And that is to regain your regenerative health, eating healthily, exercising, breathing fresh air, drinking fresh water, and using the regenerative groups like the carrot juice to ensure that you have the best health insurance. Thank you very much.